Hello, I'm Dr. Deepak Bhatt, Director of Mount Sinai Heart. Really, the best things to do to improve heart health are to try to maintain a good diet. By that, I would endorse a plant-based diet. It doesn't have to be vegetarian or vegan. It can be, but it doesn't have to be. But a plant-based diet really refers to a diet that is high in intake of fresh fruit, fresh vegetables, and whole grains. So the larger the percentage of the diet that is consisting of those things I mentioned, the better off you are for reducing the risk of heart disease, heart attacks, strokes, cancer, diabetes. So it's just a good way to have a healthy, balanced diet. Red meat, better to avoid it if you can, but if you can't, at least limit the quantities. Beyond a diet, daily exercise is important, at least 30 minutes. But for people that don't really like to exercise, I'm just really talking about vigorous physical activity. It can be 30 minutes of brisk walking, ideally something where you work up a sweat. So it can be things you enjoy doing, even just gardening. But again, it all depends on the pace of doing things. It really, I think, is key to work up a sweat. Otherwise, you haven't really worked out. But any physical activity is better than none. So even if it's just a matter of parking your car further from the store or your office and walking a bit more, or taking the stairs instead of the elevator, those little doses of exercise can add up over a lifetime. Beyond diet and exercise, maintaining a good weight is important. The natural tendency is to put on weight, but even an extra 5 or 10 pounds can increase the risk of diabetes, high blood pressure, high cholesterol, which in turn increase the risk of heart disease and other medical problems. And sleep, very important. I know hard to get a good night's sleep these days. Everyone's got a busy, chaotic lifestyle, it seems, but trying to get a good night's sleep is really important. It helps maintain a normal weight. It's also just good in terms of mental stress and for a variety of different reasons. And the final thing I'll mention is not smoking or stopping smoking if you do smoke. Really, that raises the risk of heart disease and cancer probably more than any other one vice. Beyond just saying don't smoke or stop smoking, I'll include vaping, which is really catching on among young people. That also appears to be bad for cardiac health. And while one can debate which is worse, smoking, vaping, both are worse than doing neither. So don't take up vaping if you are young and not already doing it. And if you are doing it, I'd say stop. And for people smoking, same advice. And by smoking, I mean cigarettes, cigars, all of the above. Likewise, I'll throw in their marijuana. That counts as smoking as well. I know a lot of people aren't going to be happy about that, but the reality is that also raises the risk of cardiovascular disease. So basically, a good, clean lifestyle goes a long way in terms of reducing the risk of heart disease, and as it turns out as a bonus, also reduces the risk of things like diabetes and cancer.